So here we have the plasticized heart. Again, base, apex is the tip. The coronary sulcus is the depression that's underneath of the right auricle. So underneath of here, you're going to see your coronary sulcus. Anterior ventricular sulcus is the depression that you find right here on the anterior side of the heart. If you follow it around, there's a depression on the back side, right in here. You barely see it, and that's your posterior ventricular sulcus. Again, the epicardium surrounds the outside of the heart, so you can kind of see it right there is your epicardium. Your myocardium is the flesh in between the epicardium and the endocardium, which lines the interior ventricles of the heart. So you have the epi on the outside, your myo in the middle, and your endo in the interior. The trabecular carne is the meaty flesh that you find inside of the heart. So it's actually ridges and wrinkles in here. You can't really see it, but ridges and wrinkles inside the flesh in the myocardium makes up the trabecular carne. The right and left atria, I guess you're going to find up in here. So move that aside, is you're going to have your right atria, your left atria, and the auricles. Pop that one back up front. Your right auricle and your left auricle. Your ventricles are down in here, so your right ventricle and your left ventricle. You can tell the sides of the heart from left to right based on the thickness of the left side. The left ventricle is way thicker than the right side. Some of the valves that we need to know, the anterior atrioventricular valves, the AV valves. On the right-hand side, you're going to have the tricuspid valve. On the left-hand side, you're going to have a bicuspid valve, or the mitral valve. The chordae tendineae in the plasticized heart is a little funky. It's little fibers that kind of, here we go, the chordae tendineae, which attach to a papillary muscle, which in turn attaches to the ventricular wall. Let's see if I can get it on the other side. There we go. On the other side of the heart, we have the chordae tendineae, which are the little fibers that we can kind of see in here, attaching to a papillary muscle, attaching to the ventricular wall. Semilunar valves that we do need to know. It's going to be challenging on this. Since it's split in half, this is going to be the pulmonary semilunar valve up in here. So when we close that up, it actually goes up into the pulmonary trunk here. So on this side, it would be right about in there. Kind of see a piece of it right here. The aortic semilunar valve is going to be, you kind of see it, I'm assuming the plastic models aren't going to be the best, kind of see it right up in there, and that's going to come through and up through here into the aorta.
What do you always say?
So let's put the top back on, and we can get to the inferior and superior vena cava.
He just taught us on completely over.
Is that Bill Aiken? Yeah.
No idea.
What did you just do? We were staying after. You remember when you were like asking questions?
There is one. How about every half second? So switch.
Anyway.
I'm
superior vena cava, inferior vena cava, and that's on the back side of the heart. I can't top on. Pulmonary trunk, like I said, this right in here is your pulmonary trunk, aorta, the pulmonary veins. You're not seeing it on here, but it's going to follow right along in there. The right and left coronary artery, your right would be on this side. Your left is going to be on this side. It would branch off into two sections. You can't see it. Your first one would be the circumflex. The second one's going to be your anterior interventricular artery. Coronary sinus is going to be on the back side of the heart. And I'm assuming it's going to be this section that you would see right in here. But, like again, the plasticized heart is not perfect for that. If we go over to the sink, like I said, we were going to do the moderator band. If we open up this one right here, you're going to see the moderator band. So that's your moderator band in this plasticized heart. And that's it for the plasticized.